Hi, my name's Halley Darrach. I'm a fourth year resident in the plastic surgery division, and for my professional development year I spent it with Resurge International, which is a locally based nonprofit organization devoted to expanding reconstructive surgery access globally. So throughout my professional development year, I engaged with a variety of aspects of the organization, everything from joining them on visiting educator trips to low resource nations, to working on the programmatic development here in Silicon Valley. We worked on a variety of different aspects, ranging from online virtual lecture sessions for international scholars, to working on fundraising efforts to ensure our support for the next visiting educator trips, and then also working on research and development aspects, analyzing data that we collected from our trips and from our international partners, and figuring out ways that we can expand our access. So when I initially interviewed for plastic surgery residency, Resurge International was first propositioned as a prospective partner for residents in their PD year, and once I heard about that on my interview day, I knew this was something that I was going to be very interested in pursuing. I'd always been interested in global surgery, but I'd never engaged in with any global surgery organizations. I felt at the time as a med student I didn't have any necessary skills that would translate well to the global arena, and I wanted to be able to contribute more to the projects than simply be a passive voyeur. And so finally, after gaining some basic plastic surgery skills, I felt that I could have some meaningful contributions to the program. The age-old question is, how do you fund your research year? I was very fortunate to be supported by the Donald R. Laub Fellowship. Donald Laub was one of the original founders of Resurge International, and was closely partnered with Stanford. So a majority of my funding came through this avenue, and then also from Stanford Division of Plastic Surgery. So I took call throughout the year to help support my salary. I think my PD year was a very affirmational experience. I definitely see myself engaging with global surgery and global education in the future, probably not on an organizational aspect, but as a contributor, and ideally, once I'm more established as an attending surgeon, I would love to engage as a mentor. The great aspect of the Stanford professional development year is that the world truly is your oyster. You can do anything you set your mind to. The con is that because there is limitless opportunity, it's very hard to decide. And again, a lot of things boil down to what is feasible within the confines of a year and also what is fundable. And so I would say start the search early, talk to senior residents, learn about their experiences, and also tap into your mentors. A lot of experiences came up throughout the year informally through a lot of my professors, now that I had the time and bandwidth to take on additional projects or additional opportunities that you normally wouldn't be able to within the structural confines of traditional residency. I really honestly, earnestly enjoyed my professional development year, and I think it's something that applicants and just junior residents should look forward to. It's truly been one of the highlights of my educational experience thus far.